Let's go through a scenario. Nikki, say someone I slept with texts me and tells me they just tested positive for chlamydia. What are we going to do in this consult?
That's actually like a common reason why someone would come to the Sexual and Reproductive Health Hub. We'd go through the normal stuff that we go through, make sure you're comfortable. We'd do a sexual history like we spoke about earlier and get your medical details, bits and pieces together. I'd probably find out what your understanding is of STIs and how you're feeling if potentially you do have one. I'd try to normalise it for you because it is just like any other infection that we get. And then I'd talk about the way that we test for chlamydia. I'd also be looking for signs and symptoms of an STI. So, asking you lots of questions about, if you've got any lower tummy pain. Does it hurt when you weed? Does it hurt when you have sex? Have you got any abnormal discharge? Any smells, lumps, bumps, anything that might make me think I need to take a swab? For chlamydia or asymptomatic testing, we would normally do a urine sample, and sometimes we'd add in some more tests while we're at it just to make sure you're completely STI clear. If you did have something going on and you did need a swab, there's a couple of options there too. We know life can be a bit diverse and some people are really uncomfortable about showing their genitals, so we can offer a self-collect method with a swab, or sometimes it's helpful for us to actually have a look if you've got a sore or an ulcer, and we might take that swab from that site ourselves. But we always do that in discussion with the patient, make sure they're comfortable and private, and let them know what's going on first.